all the imaging that we do every day, we see a lot of adrenal nodules. And nodule means a tumor or a growth on the adrenal glands. It is common. It is more common as we get older. So 7 to 10% in patients older than 70 years old on their imaging. And again, more imaging means we're going to see more findings. Now, anytime we have an adrenal nodule, it has to be looked at from two aspects: hormonal aspect and the structure itself, or the malignancy potential, basically. So, from the hormonal aspect, every nodule has to have these hormones checked, because it could be an adrenaline producing tumor or it could be an aldosterone producing tumor. So, we don't know. And there are cases where discovering that and surgery is actually life saving for the patients. Unfortunately, if we have an adrenaline producing tumor that is, and this is common, like I have seen a patient who is 70-year-old gentleman, had a car accident. They checked an MRI of the abdomen. It showed that he had a pheochromocytoma. So sometimes discovering this early can help prevent a stroke, or can be basically more life-saving for the patient. So checking the hormones is extremely important: cortisol, aldosterone, and the adrenalines. And of course, if there's concern about, you can also check the sex hormones. Now, the imaging features in the adrenal are extremely important and can also give us a hint of what is that. So, for example, there are some criteria on the imaging that can tell us that this might be a pheochromocytoma, which is an adrenaline producing tumor, or it can tell us that this might be more concerning for adrenal cancer. So, how do we differentiate? First, the CT scan, when it is done to evaluate for the adrenal glands, it's better to be done as a CT scan with and without contrast, what we call it adrenal protocol. And the adrenal protocol basically measures the baseline density of the nodule. If the baseline density of the nodule is consistent with a high fat content, meaning that it has a low baseline density in the measurement that we use, which is called Housenfield units. So if it is a fat lipid-rich adenoma or a high fat content, it is less concerning from the structural standpoint. It could be still producing excess hormones, but it is a benign tissue. Whereas if the baseline density is high and it is a lipid-poor adenoma, then next step is the washout, which is basically we give a contrast and we see how fast this contrast stays or gets washed out from the